And I want to thank everybody for coming. I know you might have had to drive through traffic, and I know there's construction around town, but again, thank you for coming here tonight. So I want to thank everybody for making an effort and making sure that we have an audience here. We do have CART. The captioning CART is good for hard of hearing people who like to have the English access. So we do have Dawn who's doing the a QR code. Sorry, I forgot. I moved again. I have the police back there watching me. There's a QR code on the poles in the room, and you can access that QR code. And if you need any help, the staff is here and they know what to do with that. So, everybody all right? So when people come up here to present, please make sure that you stay in one place because we do have Zoom access that we're providing to those who can't make it here in person. I want to make sure everybody can see clearly and hear clearly. Make sure that you move around so you can see everything that's going on and everything we're presenting for the commission tonight. So this is how we sign connection. And we want unity. We want to be united and we want to support each other. And again, what you learn here tonight, keep that, make sure that you tell people what you've learned. Oh, I know, I'm sorry. I'm not going to be here for an hour. Don't worry. Don't worry. So yeah, make sure you tell everybody things you learned tonight. Spread the information around to everybody in the community. The food was donated by OAD, so we want to thank Omaha Association for the Deaf for that. Drinks were donated by NEAD, the Nebraska Association for the Deaf. I want to thank everybody who put in all the hard work to bring these donations here. Restrooms are past the kitchen. They're not downstairs. They're the ones that are past the kitchen. So at the connection hour, we are going to talk about the strategic plan. And that has been a huge job to complete. We haven't done it by ourselves. We've done it with all the community partners. You've all been a big partner in helping us develop this strategic plan. It's been great to have all these partnerships. I do want to introduce Kyle Mears. Come on. He is our executive director for the Nebraska Commission for the Deaf and Hard of Hearing. And that's a statewide agency. I'm sure most of you have met Kyle already and had conversations with him. Raise your hand if you know him. I'm sure there's people on Zoom that have met him already too. He's very busy. He's got many different things he's trying to accomplish here, but we're happy to have him here with the commission. So now, bring up Kyle.
Thank you, Valley. Thank you. Thanks, Valley, for the introduction. I'm very excited to be here tonight. And I think our stakeholders here are key for the alliance with the commission. I've started now almost 7 months ago. And within those 7 months, we've just hit the ground running. Had a lot of meetings with deaf stakeholders, with the deaf community, with hard of hearing folks, gathering information for the strategic plan for the commission, which was recently approved by the board in June. Does that mean we're done? No, we've got more work to do. The second phase is working on a work plan, what we're going to be doing in the next 5 years. Recently at the board meeting this morning, they took a look at that work plan. They seemed very happy with that process. So what's next is the staff is going to delve into specific activities for the next 5 years. So we're very, very busy, letting you know. And I'm very proud of our team. Before I started, I want to introduce my team, I guess, before I start tonight. Raise your hand if you're on my team. We have Valley, we have Ashley here. We have Kendall back there taking pictures. She's our marketing specialist. We have Kim, Jeremy, and we also have Sakura up here up front. Anybody else? Oh, and plus myself, I guess the most important person. No, just kidding. We have 3 board members here as well. And we had a meeting this morning. The board, some of the board members were busy and needed to leave, but we have Richard, who is our vice chairperson. Richard over here. And then we have Diane Shute. Shute, yes, Diane Shute. That's another board member back there. And then we have Candace right over here. So 3 board members are here tonight. I want to thank them, and I also want to recognize names of different organizations that the commission has been partnering with. We have 3 advisory committees. We have the Interpreter Review Board, and then we have the Mental Health Advisory Committee, and then we have TRS, which is the Telecommunication Relay Service. So the commission is involved in all 3 of those advisory committees to provide better access for people who are deaf and hard of hearing in Nebraska. We also have internal boards and committees, and that's currently under review. But we also have more. We work with Boys Town. We work with the Iowa School for the Deaf, because during the last school term, we had 22 Nebraska students attend the Iowa School for the Deaf. Now how many? We're still at 22 this year. 22 deaf students are attending the Iowa School for the Deaf. So it's important to have that relationship with them. We have the Lincoln Association of the Deaf here. We have the Nebraska Association of the Deaf. We have Nebraska Mentoring Program, the Deaf Museum, and we have Hands and Voices. And then we have the Nebraska RID, Registry of Interpreters for the Deaf. We have OAD, Omaha Association of the Deaf. We have NSTEP. We have Brett here, who's going to talk about the NSTEP program. So each of these people will have a brief synopsis on how we've been partnering and how we will continue to do so. So we have a lot of things happening. First of all, we have our vision statement, which is important. Access is a foundation in every part of life. From birth all the way to grave and everywhere in between, access. And that is our vision statement. Our mission statement is, how do we do that? It talks about, we as the commission, what are we going to do? We will educate and engage Nebraskans by advancing equity. So whether you're deaf or hard of hearing and hearing, there's no difference between the two. They're both equal. And how we do that is by influencing policy and ensuring communication access across information, services, making sure that the community is involved. We can't do this ourselves. We work with the community. You tell us to make sure that we're on the same track, and then we can be your facilitator with government. Our strategy is based on 3 foundations. First is educate, which means we're working with the community to enhance understanding and awareness of people who are deaf and hard of hearing, with the deaf community, with service providers, with government, providing that education. That's a big part of our role. Second is engage. We're working with you to make things happen. We're not doing all the work. We're making sure that resources are available to make those things happen. Equity means we're not looking at things that are not equitable. Say services, like I have to register through a third-party app when a person who can hear does not have to. We should have the same access to information services that a hearing person has without having to take extra steps. We have 6 strategic goals. First is to advance awareness and community leadership. Community leadership is important. That influences how we influence and also how we influence government. Working collaboratively on that. Second, strengthen communication access and interpreter standards. That's important because communication is key for our access to information, how we receive it, how we provide information, and how we make decisions. That's very important. What are the standards? And communication is very important in that. We're looking at interpreter standards in Nebraska. Do we have qualified interpreters? Do we need professional development? Taking a look of all of the needs. Within the next month, we will be having a stakeholder roundtable meeting with the interpreting community, agencies. We'll all gather to talk about the future of interpreting in Nebraska. So I'm excited to start that process. Third, influence policy and foster system level change. That also is very important because we can't do everything. Different government agencies, their services need to be accessible. They need to improve their access for people who are deaf and hard of hearing. It's not us doing the work. We will work together with them. And at the same time, how can we foster that change of policy? It could be through policy or it could be through legislative changes. Either way. Fourth, expand responsive and innovative services. Any gaps or things that are missing that people who are deaf or hard of hearing need. We could look into looking into grants to establish new programs and services. Maybe a one-off, I don't know. It's really a very open field. It's not limited to what we can and cannot do. It's open to whatever potential there might be. 5, ensure accessible health and behavioral care. Also very important, mental health services, making sure that services in Nebraska can provide access or provide the right services for people who are deaf and hard of hearing in Nebraska. So that's important. Sakura here plays an important role in that. She's making sure to educate and work and foster those policy changes, wherever that might be. That is Sakura's role. Last, to achieve all 5 of the above goals, we have to look internally in our organization. What can we do as an organization? Do we have the right resources? Do we have the right staff? Do we have the capacity? So we take a look internally. So we do we have data? Do we need the data? How are we going to collect the right data to support those 5 goals? That's very important. All right, well, I've already jumped ahead and talked about this. I guess I'm excited for our new strategic plan, but I did cover these points, so let's move on. Yep, I talked about that. So interpreter quality, overseeing. Really, clearly, I know my stuff. And so I'm happy about that. I missed what was on the top of that. What does it say up there? The captions are. So now our next strategy is creating a work plan. Step one, I talked about when they interviewed me for this position. I said within the first 100 days, 3 to 6 months, I would develop a strategic plan. I can check that off the list. Now is developing a work plan. Details for short, mid, and long-term goals. So as a team, we can look at things that are easily achieved or will take a little bit more time. I think we may focus on some easy wins. And so NCDHH can be successful. One good example, recently the legislation passed a new law about cell phones being banned at public schools. So our communication and media marketing person, Kendall, developed information and sent that out to parents of deaf children, making sure cell phones would be included in an IEP or 504 plan to make sure that's in theirs, which would then allow a student to use that phone to get in contact with their parents. Another organization, what was the name of that organization? The ACLU of Nebraska, which is a large advocacy organization. They asked us if it would be okay if they shared that information with over 25,000 users. So they're thankful to the commission for doing the work, for them to become more aware. So it's not just benefiting deaf or hard of hearing, but also other disabled groups too. So that's an example of the work that we're doing. So kudos to our team for that. Deaf gain is right. So in a nutshell, I think we have a lot of stakeholders here with us tonight. I want to work with you to make sure that we're successful for the deaf community and hard of hearing community here in Nebraska. I thank you for all of your wonderful work. I want to work with you in collaboration. If there's anything you need for support, I'm here to support you. I'm here to fight the government for you, but I can't do that alone. We have to work together as a collective group. We stand better to make opportunities to have a better outcome for the deaf and hard of hearing community in Nebraska. So I really appreciate you being here tonight. And that quote, you want to go back a slide? So together, we are shaping a more equitable Nebraska built with and for the community. And I think that's important that we work together. So now I will ask each one of you to give a brief synopsis of your organization, what you do, and how you're partnering with the commission. So we will be starting with, oh, we're doing the ribbon cutting first. All right. So before we have people come up, we have a ceremonial ribbon cutting ceremony. So I want to ask Diane Shute to come up. And Candace. And Richard. So we're celebrating the launch of our new strategic plan. The launch of our new strategic plan. And did I do all of the work? Absolutely not. It was from community involvement to shape our strategic plan. So let's celebrate our achievement of the strategic plan. Ready? Ta-da! Congratulations. Thank you. Thank you. Thank you, Diane. So again, 2 to 3 minute short synopsis of your organization and what it is that you do. So first we're going to ask Megan Cassidy to come up and talk about the Interpreter Review Board. Hello, everyone. My name is Megan Cassidy, and I am the current chairperson for the Interpreter Review Board, IRB. Our group was founded in 2002. The first group decided to establish rules and regulations for sign language interpreters for them to receive their licenses in Nebraska. These regulations applied only to hearing interpreters. Later, they added certifications and qualifications for deaf interpreters. We currently have a board of 8 people, 5 deaf, 3 hearing. 2 are local government representatives, both happen to be deaf. 2 are deaf and hard of hearing representatives. 1 is a CDI, certified deaf interpreter. We have the executive director as a part of the group. Then we have 3 hearing people, which is me and another interpreter who is a child of deaf adults, CODA, and a DHHS representative. Altogether, what we do is if someone feels that an interpreter may have done something wrong following the NAD, RID, CPC Code of Professional Conduct, if they violated one of those tenets, we meet quarterly. So if someone files a complaint, then there is a third-party private investigator to do the investigation of the case, and then the report is given to us. We meet as a group to decide whether or not any of the professional conduct rules were violated, and if they were, we decide discipline. And if so, then we would provide our recommendation to the full board. Our goal for the IRB is to make sure that people who are deaf and hard of hearing have access to equal communication. If something goes awry with that, we want to know about that. We want to make sure that your communication access is protected. If you want any more information about our group, take a look at the NCDHH's website, and it's under Interpreter Review Board. Thank you so much. And this is Valley. We do want you to ask questions of each person. If you do have a question and you want to understand something, tonight is your opportunity to ask questions. We'll try our best with Zoom participants. We'll try to watch if you're posting anything in the chat. We do have someone monitoring that. If you do have a question, go ahead and ask. Do we have any questions for Megan about the IRB? So everybody seems to be very knowledgeable. Anybody on Zoom? Seeing none? All right. Thank you so much, Megan. And this is Kyle. Next on the people up to talk are our Mental Health Advisory Committee representative, Cody McAvoy, who has just now arrived. Cody, are you ready to get up here? Come on up, come on up, come up through the middle up here. Watch out for the cord if you're going that way. Hello, hello. Sorry, I just got here. Oh, Mental Health Advisory Committee. Okay. So the MHAC is a mental health advisory committee established by the commission. We have different members who are counselors, mental health specialists, interpreters, those who are involved in that field. The goal is to provide mental health services in Nebraska, accessibility, culture awareness, and looking for counselors who know sign language or deaf culture, because there aren't that many. We have one licensed counselor in Nebraska so far. So we're really looking for expanding that. So we talk about how to improve those accesses to mental health services. Committee roles, role models are there. We talk about strategies as far as what to do. It's led by Sakura, who works at NCDHH and sitting right over here. So yeah, I think that's it. Did I miss anything? All right, any questions on that? We post email, website. If you feel like you want to come and experience the meeting, keep an eye on the website for when we're meeting. They alternate typically between Omaha, Lincoln. Sometimes we hold the meetings through Zoom. Any questions from Zoom members? All right, seeing none. Thank you, Cody. Ready? Okay. Oh, next we have the Telecommunication Relay Service Advisory Committee, Norm Waverka. You good with him? He's kind of hard.
Good afternoon. My name is Norm Waverka, and I am on the TRS Advisory Committee. That committee was established when the relay system was first established in Nebraska. It was established here at a small Omaha group with 2 deaf people and 1 hearing person. And we decided that this should be a committee that focuses statewide, not just in Omaha. So the Public Service Commission established this committee because there was a relay service in Nebraska. When we were setting up the organization, or this committee first, there were a lot of legislative bills that we proposed to distribute equipment. The Public Service Commission and the NSTEP program were both established, and those are for people to receive free equipment with an application. Back at the beginning, it was TTYs, and now new technology has emerged on the market. So cell phones are now available through this program. That program has served many deaf people within the community. And our job in the advisory committee is to gather information that deaf and hard of hearing people, deafblind people speech impaired folks. We gather information on phones that are accessible to them. Access is very important. That equipment through the program is available for anybody who is deaf, hard of hearing, deaf-blind. As time goes by, of course, we meet once a year, early on in the year. I'm the vice chairperson for that committee.
Tammy Richardson Nelson.
Tammy Richardson Nelson is the chairperson. Her husband and her were the first people to establish this advisory committee, and she's been involved through the years. When we meet, we discuss what we could possibly do to improve access to phones for deaf and hard of hearing people across the state. And the Public Service Commission houses the equipment and the technology that's available in Nebraska. And we want to make sure that the deaf and hard of hearing community has the same access as people who can hear. The last two things that we have accomplished was getting 911, because Nebraska didn't have access to text to 911.
Okay.
It wasn't accessible across the state of Nebraska, only in pockets. So in 4 years ago, we were able to let the Public Service Commission know that every county needs to be accessible for text to 911. And we've experienced some problems with that. Every county in Nebraska has different phone companies that service their area. There's not a consistent company that services all phones in Nebraska. So we had to get their service provider in that specific area to convince them to get text to 911. They'd have to change their system, and we'd have to do that for each phone company. So it was a challenge to get the phone companies on board with this. I think 2 years ago, or maybe last year, we were able to achieve full coverage for text to 911 within Nebraska. Except for a tiny, tiny spot in northeast Nebraska. We're still struggling with that. It's right on the border with South Dakota. And so we're still trying to achieve that little pocket. And most of you know that you are able to access, apply for free cell phone. For a long time, it was just one phone. And then we were able to increase that number to 2 phones or devices per household. So basically, our committee depends on your feedback and the commission, their feedback. We have to have that. We need to have that feedback and collaboration to make sure that we're satisfying the goals of the deaf and hard of hearing community. So we need the advisory committee to get together and make sure that we're providing everything we can for Nebraska. Any questions? Oh, hang on just a second. There's a question on Zoom. Recently, we saw the application information for cell phones. After it's been filled out and mailed, NSTEP sends a voucher to the person or the phone company, for example, T-Mobile. So I think they're asking about the voucher. Who was that mailed to? Is it to the person or is it to the phone company? That would be a question for Brett to answer. They deal with the contracts for the vendors or with the different companies. The advisor committee does not do that. So the PSA would be responsible for giving out the vouchers every 2 years. excuse me. So sometimes we need to have them take action if a vendor isn't being responsive. There is another question. You mentioned that all counties in Nebraska, except for one small county in Northeast Iowa, can text to 911. Is that correct? Nebraska, sorry. So what if somebody forgets to pay their cell phone bill and there's no service to their phone? Can they still send a text to 911? No, your phone has to be working. You must have service. I'm not sure. Brett could probably answer that better. Or can you move over a little bit more for the Zoom camera? Sorry, I gotta stay on my spot. I think you have to have an active phone service for that phone to work. Otherwise, I'm not sure how you would send a signal, but I don't know. Hearing people are able to call 911 without an actual connection. So I don't know if text was the same way. This is Norm. Unfortunately, you have to remember that there are some rural areas in Nebraska. Some hearing people don't even have phones that will work. Some just won't be able to send a text. It won't work in some areas. They're working on making sure that it is more effective for everybody. They're working on that to try and increase access. That's the goal right now. I do want to mention that we do have 3 vacant positions on the board. We need somebody who is speech impaired. For a long time, we've had nobody fill that representation. We also need a representative who is deafblind. We do not have, we have a vacancy in that. And we also have a vacancy in the hard of hearing position. We've been waiting for people to apply, but if you are interested, please join our committee. Is that all the questions? Great, thank you.
This is Kyle. All right, thank you. Thank you very much, Norm. So we have 3 very important committees that are located under the commission. The others are a part of community stakeholders. So we'll bring up Iowa School for the Deaf, the superintendent.
Hello, good afternoon. My name is Chris Cafton. I'm the new superintendent for the Iowa School for the Deaf. I started a little bit over a year ago. The reason I'm here is because we do service students from Nebraska at Iowa School for the Deaf. As Kyle mentioned at the beginning of his presentation, we do have 22 students from Nebraska who come to the Iowa School for the Deaf because the Nebraska School for the Deaf closed. And we have been working to make sure that the deaf and hard of hearing youth in Nebraska and if their local school doesn't have services, we want them to know that ISD is an option. We're working closely with the Nebraska Department of Education. Dr. Amy Roan, Tarsha Pellin, Sarah Peterson. We're working closely with them to make sure that we are providing services for the deaf and hard of hearing students in Nebraska. We give feedback to the parents and let them know their rights. Some parents have become very frustrated that their local school district will not provide access for their child or even a residential placement. some families have struggled with getting their children placed in the dorms. So we make sure that we let them know the benefits of Iowa School for the Deaf. So we do work with the Nebraska Department of Education and the Nebraska Commission for the Deaf and Hard of Hearing too. So that's my role here and how we work together with NCDHH. We do have a question out here. This is Vicki Valley. How will you support the Nebraska Commission for the Deaf and Hard of Hearing strategic plan going forward? And this is Chris. Oh, I think I'm stealing your comments from the spring, Kyle. Really, every one of those 6 goals that Kyle mentioned all work together. You can't have one without the other. The children who come to, Kyle came to ISD in the spring and we discussed with the leadership team about language deprivation. And he reminded me that it's experience deprivation. And that's one thing that I really remembered, that we need to communicate with the families, the school districts. And again, his point was experience deprivation. That impacts everything. And that's how we're going to work with the Nebraska Commission for the Deaf and Hard of Hearing in all of the strategic goals. Any Zoom questions? No? All right, thank you.
This is Kyle. Thank you. Yes, Chris is right. We're talking about experience deprivation. Language deprivation can have a negative connotation to it. People don't really understand what that means. When we talk about experience deprivation and we talk about life and navigation of that. So yes, kudos to the Iowa School for the Deaf for really following through with that. Great. I apologize. I missed Boys Town. So let's bring Boys Town up. Hello again. My name is Cody McAvoy. For those of you who don't know me, I am currently working with Boys Town. Boys Town has been involved in the deaf and hard of hearing community for quite some time, and it has changed over time. They used to have camps and just a variety of services, which I'm not very well versed on. However, now what I do is I'm a counselor for deaf and hard of hearing youth from kindergarten to 12th grade. How this started was Nebraska School for the Deaf closed, and the state provided funding for the School for the Deaf. And instead of that funding being withheld, they decided to establish Nebraska regional programs. Resources for families, activities for socialization, because at the School for the Deaf, that's where students had that opportunity. So Nebraska regional programs took on that responsibility. So Boys Town contracts, which started back when the Metro regional program was in existence. They have mental health counseling in school-based settings. So what I do is I'm an itinerant to different mainstream schools, public schools, to work with deaf and hard of hearing students on their identity navigation, being in school, isolated, alone. So I travel to different schools. Now I've recently changed to statewide. This is the first year that they've opened this up to the state. So with Western Nebraska, most of the counseling will be done virtually. I have another counselor that works with me part-time who is also a preschool teacher. So with just the 2 of us, that's not enough. So we have to do virtual services for some of the folks out west. Last year, between the 2 of us, I believe we served 70 to 80 Nebraska deaf and hard of hearing students. So it is big here. And a lot of people aren't aware of the services that are out there, the agencies, the resources, Lots of times a parent, it's the first time that they've ever experienced being around anyone who's deaf. So that's the counseling piece. We also do still have a deaf program, a preschool program, ages 3 and 4. They recently hired a deaf para this year. So those are the two main programs at Boys Town. And of course, they have audiology and speech services and youth research and physician services. We have Jamie Peterson here, who is a research person there, and she does a lot of research for them. So that's kind of the general idea of Boys Town, who has contracted with the Omaha Regional Program to provide services. Questions on that? So this is Valley. How do you feel like that supports NCDHH's new strategic plan? I know that you missed that, but Cody says yes, but it was talked about at the Mental Health Advisory Committee meeting. So how does this align with that? I think the best person to talk about that would be my supervisor, Amy Tyler Krings. That would be the person who really is involved. She's the director of Boys Town, the preschool program, the counseling program, and audiology. She oversees a lot of the programs. My role as a counselor, I can say that a lot of families, students that I work with really are unaware of agencies and organizations and resources that are out there. And so a lot of times I work with kids and I tell them about these things. And obviously NCDHH has a lot of advocacy services and a different role than what I have. So that could be benefiting them for growth, learning, independence, living skills, just proving that people who are deaf can do anything. So sharing what Nebraska has, because a lot of people really are unaware of that. Anything on Zoom? Nothing on Zoom? Thank you. Thank you so much. I grew up in Nebraska. This is Kyle, and I did attend Boys Town. Started in 1981, and from that point forward, and I loved their program. Good, fun, fond memories. Some of the people who attended that Boys Town gifted program, you were a counselor, Lindsay Jr. went, Marie went, Kim went. We had a wonderful time at Boys Town. Anyway, let's go with James Campbell from Lincoln Association of the Deaf.
Hello, I'm James, and I am the representative for the Lincoln Association of the Deaf. We make sure that we are uplifting the deaf community and making sure that people aren't alone. We're here to support each other, and not only deaf adults. We are here to support people who have deaf children as well. We are celebrating our 100th anniversary next year in March 2026. So come and support us. We are thriving, we're growing as an organization. And I guess that's about all I can say, but I'm happy that the commission asked us to come here to represent the deaf community in Lincoln. Any questions? Oh, Valley's got one, of course. This is Valley. Yes, I'm going to ask this question of everybody. How do you feel LAD can support the strategic plan of the commission? Obviously, the deaf community is small, but we have a big heart. So we want to make sure that everybody is connected. And we want to make sure that everybody is supporting the commission and make sure that our big hearts are continuing to be shared for everybody. Oh, any questions on Zoom? Oh, right. Nope, one more question. What is LAD's meeting? We used to meet monthly, but now we meet 3 times a year. So we will get together. We do have events that we coordinate also. Any other questions? All right, thank you.
This is Kyle. Thank you, James. Lincoln Association of the Deaf, currently in their 99th year, soon to be 100th. NCDHH will, of course, sponsor and support them with whatever plans they may have. We have Jonathan Artiega with the Nebraska Association of the Deaf. Hello, everybody. My name is Jonathan. Last name's Artiega. I am with the Nebraska Association of the Deaf as serving as their current president. 2-3 weeks ago, we had our conference. That was my 3rd term running for president, and we have the same board members except for 3 new people, a delegate, Lindsay Jr., a vacant position as a parent liaison. If anyone is interested in running for that position, please contact me. And then we also have a new secretary, but otherwise the board composition has remained the same. Fairly soon, we're planning a retreat for our board to talk about our plans for the next couple of years. So keep an eye on that on Facebook. We're constantly providing any updates on our Facebook page, anything with NCDHH, bridging whatever they have statewide with whatever we have statewide. If we have a bridge between LAD and OAD, all of us just becoming one and working together. That's our goal. NEAD serves all people who are deaf and hard of hearing, providing families advocacy, public services, and we've done that since 1902. Any questions? Same question that we've asked everyone else. Right, so thank you. The answer is, Jonathan is saying, remember his strategic plan, whatever is there, will take time, step by step, by all of us working collaboratively under the commission. Whatever he needs, we'll be there to support him. Any questions? And James is asking, what was the question? How many times do we meet was the question. And the answer is 4 times a year. And again, keep an eye on Facebook. That's where you can find information and updates. Anything else? And nothing on Zoom? Sorry, wait, sorry, wait. Say the question again. How many times or how often do you meet for conference? The conference is done every 2 years for elections, but then we have a biannual conference that happens the off year between elections. Thank you. This is Kyle. Thank you, Jonathan. I think the Nebraska Association of the Deaf is an important ally. Some of the work that we do, we are a state agency. There are some things that we cannot do. And so we can reach out to NEAD to support NCDHH to do the work. So they're an important stakeholder. Next, we're bringing up Nicole Froelich. Did I spell it wrong? F-O-R-E Lich. Okay. Sorry. Anyway, we have the NEAD Deaf Mentoring Coordinator. You're up.
that my last name is very hard to spell. You're going to have to practice it throughout the year, Kyle. That's your goal for this year. Says, yep, I will be practicing. Hi, my name is Nicole. Now I spelled my last name wrong. Froelich. I'm the program coordinator for the Nebraska Deaf Mentor Program. We focus on ages birth to 3, and we get our referrals from Eddie, which is early hearing detection and intervention. So Eddie refers families to us. We get these families and assign them a mentor. We have 3 in eastern Nebraska and 1 mentor in western Nebraska. So the mentors will go visit the homes of these parents who have just had a deaf child, and we discuss culture. We will have activities like story signing time. We will play with the toys that the child has, just to make sure that we're making connections with the family and the child. And it's not just home visits. We have these families interact with the community. We're trying to provide workshops for the parents. We're trying to collaborate with Hands and Voices and the regional programs in Nebraska. Yes. Oh, I just lost my train of thought. We're working right now to develop a communication policy and a cancellation policy. So that's our focus right now. I've been working for about 4 months now, almost 5 months. We're designing brochures that can be distributed to families, and we can distribute to organizations as well. OED, LAD, the Nebraska Regional Program. When we get that designed, we will distribute those to all the organizations. Yeah. This is Jonathan Artiega. This is a very important program. It was established 3 years ago. We won a grant to make sure that the families of deaf children are the focus here, and this organization is under the Nebraska Association for the Deaf. And we want to show that deaf people can have different roles in life, and we want to make sure that the families have a connection to the deaf community, so they see that their child's future is going to be fruitful. It's wonderful that Nebraska has this program and all the collaborations that we have here with Eddie and other organizations. And she's only been here for 4 months. She's been doing a great job. There's a couple questions. We'll go ahead and start with Norm.
So you say you're working with the early infant program in Nebraska?
Yes, we just had a meeting 3 weeks ago. We wanted to partner with them to distribute information and let everybody know what we provide in this program. And this is Valley. Want to ask the same question again. What can the Deaf Mentor Program do to support the Commission's strategic plans? When the child becomes 4, the parents might not feel ready to not have any services. So we will pass the family on to Ashley. She is the education family liaison. And they will also be connected with the Nebraska regional programs. When the child is 4, They will not be in our program anymore, but we will connect them with these other programs and resources to make sure that they have the support they need. Any other questions? All right, thanks.
This is Kyle. Thank you. Youth are very important to us. They become adults, leaders in our deaf community, so it's important to support these youth programs. Next, we have Lindsay Darnell Jr., who is a classmate of mine at the School for the Deaf. We grew up together, we were roommates, and lots of memories. And Lindsay loves history, loved it back then, and he still loved it right now. And so we'll bring him up because he's a perfect person for the Nebraska Deaf Heritage Museum and Cultural Center. Yes, my ex-roommate. Thank you for that wonderful introduction. So I have a question for you. Who loves history? Raise your hand. Good. So I'm going to give you two names. These are the two leaders who founded Nebraska Commission for the Deaf and Hard of Hearing. NCDHH used to be called the Nebraska Commission for the Hearing Impaired. Ugh. Anyway, but people wised up and changed the name to Nebraska Commission for the Deaf and Hard of Hearing. But these two people graduated from the Nebraska School for the Deaf. First, we have William Ivins. And second, we have Edward Reitz. These two gentlemen were very active, and I believe Norm was even there at that time. He's shaking his head yes. Richard was one of the early people who were involved in NCDHH. So we have history, and we have a piece of history right here with us tonight. During all of that happening, I was just a little boy. And so don't let this white beard fool you. Okay, so again, my name is Lindsay Darnell Jr. I am the president of the board for the Nebraska Deaf Heritage Museum and Cultural Center. This museum was founded and established after the School for the Deaf was closed. When NSD was open, they did have a museum which was established by alumni. However, the property was owned by the state. When the School for the Deaf closed, we, under the Nebraska School for the Deaf Alumni Association, rescued items from being sold and got those from the state. Once we had these items, we opened the museum in 2001, and it's been in existence until now. August of 2026, next year, we will be celebrating 25 years. So keep an eye out for a large celebration. What we do, first of all, is we preserve history for posterity purposes. First, then we collect items, photographs, books, stories, materials. Part of that information and collection is from the School for the Deaf. Other things are from people who are deaf, life's experiences where they have contributed those to the museum, adults who were former students, and even people who attended public school programs. We're now in discussions with one person who grew up attending public schools in Nebraska, who has won many gold medals for their school on the swim and dive team. And they asked, what can I do with these? Can I donate these to the museum? And I said, absolutely. Because our criteria is anything related to Nebraska and anything related to deafness. That qualifies and that belongs in our collection. So what I've done now is I've focused on developing collections with a CMP, the management program, the core policies that are needed to support the museum and their archives. One step, then moving down, then that will raise our museum to a level of professionalism similar to other museums. So that's currently what we're working on. We're very fortunate to have a person who graduated from University of Nebraska Lincoln, majoring in library studies, collection management, policy. So that has really helped us a lot. Right now, this person is focusing on cataloging items and working on getting those done for us. So I want to answer Valley. Where is she? Valley, I want to answer your question before you even asking me. So where does the museum fit in the picture of NCDHH's strategic plan? What I see is not only a one-way support, but a two-way support. And that's true for all of us. It's a two-way street. The museum is a wealth of information. And information is key, meaning that there are cool resources. Like, let's say a family wants to make decisions. Come to our museum, take a look at our pictures from 150 years ago. Take a look back and say, I want my child to be that person. Professionals, send them to the museum to look at things that we've already done and things that they can repeat now. It can help with innovative ideas, education, interpreting history, children of deaf adults. The list goes on and on. So supporting each other, all of the information is there. We also have an ulterior motive. I'm going to tell you right now, it's not a secret. One of the goals is to sensitize the public to the need of the deaf and hard of hearing community. And how we do that is through our museum, our collections, our resources, and our interpretations. More so of an impact for people who make policy. When they come and visit our museum, our goal is when they leave our museum, they will have an increased respect for people who are deaf and hard of hearing. And that's where I can see our role aligning with NCDHH's strategic plan. Questions? All right, thank you. This is Kyle. Beautiful. History is very important. Important for people who are deaf and hard of hearing, their parents. Shelly, come on up. I'm gonna watch this. Nope. Oh, she's interpreting. She's interpreting.
Okay. My name is Shelly Janning, and I have a daughter who is 19. We just sent her to college in Texas. She has single-sided deafness, and that is why I got involved with Hands and Voices. Hands and Voices has been around for a long time. Our goal is to help provide support and information to families who have kids who are deaf and hard of hearing, regardless of their age. We have different events and activities. We just want people to be able to network with other people and be exposed to other deaf and hard of hearing individuals. I am also the program coordinator for the Nebraska Hands and Voices Guide by Your Side program. We are funded by the Nebraska Department of Education. We serve families 0 to 21. We currently have 11 hearing guides throughout the state of Nebraska who all have kids with different hearing differences. We serve about 150 families, and our support looks different for all of the families. Some families we're more involved in, maybe they have more needs, maybe their baby has just been diagnosed. Or we have other families that don't need a lot, but yet they want to stay connected with us because you just never know when you may hit a bump in the road. Can you hear everybody hear me? Okay, okay. So our favorite events are our Mom's Night In events and our Parents Night In events that we're trying this year for the first time. We offer one in November and one in February, and it's an educational session. Actually, 3 educational sessions. We do a lot of crying, a lot of laughing, a lot of learning. In the morning, we have a panel of deaf young adults come and talk about their experiences. It's probably the highest rated part of the whole event. I think these parents just want to know that everything is going to be okay. And I think they leave really feeling refreshed and feeling more equipped to raise a child who has a hearing difference. We also have the ASTRA program, the Educational Advocacy Support and Training Program. And that is for anyone that is, or anyone who is deaf and hard of hearing that's school aged and their families want more information about their educational rights. Sometimes we go to IEPs with families. Sometimes we talk with them before IEPs. Sometimes we refer them to other organizations that may be able to fit their needs better. A lot of what we do at Hands and Voices is provide unbiased information and support. We have the connection with a lot of these families. I would say right now we're probably getting about 65% of our referrals from the newborn hearing screen. The other ones we're getting from audiologists, teachers of the deaf, teachers, social events, the regional programs, and so forth. And so what we want to do is just make sure that they are connected to all the other programs that may be of benefit to them. And how we can work with the Commission for the Deaf and Hard of Hearing, I just think is getting information out. I think empowering families to help their children advocate for themselves. I'm super proud of my daughter. She is an amazing advocate. And I think she's seen my husband and I role model that through the years, which I think has just made it so much easier. I think she's met deaf and hard of hearing individuals that, again, she knows that she can be successful. And I think that makes all the difference. I have a rack card. If you guys want some, I have some extras over here. I have an Astra pamphlet if anybody wants that. And then I also created this. I think when families have a child diagnosed, especially from the newborn hearing screen, they have so many different agencies contacting them that I created this. This just talks about different agencies that may contact families early on, which includes obviously Hands and Voices, the Early Development Network, the regional programs, the Commission, as well as NEAB and the Deaf Metro program. So our goal is just really to connect families with resources and make sure they know they're not alone. Any questions?
How to become a volunteer for this organization?
I can give you my card and you can email me and we can talk about that more. Thank you.
Thank you. This is Kyle. Yes, parent groups are very important to NCDHH as well. Next, we have Nebraska Registry of Interpreters for the Deaf and Julie Bergman. Yes.
Hello, everybody. My name is Julie Bergman. I am on the board of the Nebraska Registry of Interpreters for the Deaf. I am the treasurer. NERID is a state chapter of RID. And our organization is run based on RID's policies and ideas. Nationally certified interpreters, state licensed interpreters are involved with NERID, and we are focused on commitment to growing the profession of interpreters. We focus on collaboration, continuing education for the interpreters, mentoring, networking, and advocacy. For the Commission's strategic plan, we are in a unique position to partner with them. Currently, we've started that process of collaboration already. One thing that we have already started is encouraging interpreters to participate in different workshops around the state and the country to improve their education. We've supported the interpreters financially by providing money for them to attend workshops. We've also started a scholarship program, reestablished a scholarship program for hearing interpreters and deaf interpreters. And that is to help reduce the costs required for certification and also close the gap between graduation and certification. With everything that we have started and we continue to do, as Kyle mentioned several times, we have had a roundtable discussion, and many of our board members are very excited and ready to put the work in to support NCDHH with interpreter improvement and any other opportunities that we can have to collaborate with the commission. Any questions? There's one question. Maybe I missed it. I was taking photos. How many NERID members do you have right now? So Julie, right now we have 20, around 20 members. Somebody said it should be more. This is yes, we need more. Absolutely.
This is Norm. So are you having a situation like, we're having difficulty getting interpreters in Nebraska because we know that pool is dwindling.
It's my first year on the board. I just want to start with that. So I don't have the whole history of NERID, but for what I can see with our registration and our numbers so far, this year we have less interpreters as members as we have in previous years. But the reason for that, I'm unclear of why. Norm said that's something to work on. Julie said, yes, we are absolutely working on that. No Zoom questions? All right, thank you.
This is Kyle. Interpreters are important communication access. So again, we want to collaborate to improve that in Nebraska. One is the Nebraska Regional Programs, NRP, educational program. Abby should be here, but instead we have Ashley who will be talking about that. I'll try my best to talk about the Nebraska regional programs. It is a statewide program that serves any deaf or hard of hearing, deafblind student in Nebraska. They have 4 different regions. They just recently changed some of the region's names, so I'm trying to remember. We have Southeast Regional Program. We have Greater Metro Regional Program, Northeast Regional Program, and then we have Central West Regional Program. Each one of them has their own program coordinator, which represents their areas. They work with families, school systems, deaf and hard of hearing children, making sure they get all their resources and support that they need. They host events for families and events for deaf and hard of hearing students. They work closely with a lot of stakeholders as well, including NCDHH. And they typically have an annual summer camp called Camp Anderson that occurs yearly. Some of them will host deaf and hard of hearing dances in each of their regions. They may have family weekend events. I think there's one coming up soon. They have kids that go to Close Up. They have Battle of the Books from Gallaudet. They have Academic Bowl. So pretty much they're very heavily involved with deaf and hard of hearing educational public school systems. Any questions? I will try my best to answer. I'm not going to guarantee I have an answer for you. And then historically, funding from the Nebraska School for the Deaf was then allocated to create the Nebraska regional programs and their respective 4 area regional programs. How do you think NRP will support Nebraska or NCDHH's strategic plan? That's a good question. I don't really have an answer for that. I'm just filling in to give information about what I know. Person best to ask may be Sarah Peterson, but thank you. All right, this is Kyle, and I want to acknowledge the Omaha Association of the Deaf, who is our host for tonight's connection, and also Nebraska Association of the Deaf. Marie, do you want to come up and talk on behalf of Omaha Association of the Deaf?
Thank you. Hello, I'm Marie. Marie Proteski. I'm the Vice President of Omaha Association for the Deaf. We meet the 3rd Saturday of every month. You can find information on Facebook. And we have a hall that people can come and support each other, share resources. We have an ASL game night. That's the first Friday of every month. What else? Next Saturday, September 20th, we are having an operations meeting. The Nebraska football game is going to be on. You can come watch on the big screen, go Big Red. We'll also have a dinner. We have the senior citizens group on the 1st and 3rd Thursday of the month. Any questions about OAD? Nope. All right. Oh, there's one. Valley. Same question I've asked everybody. How do you feel that OAD could partner with the Nebraska Commission for the Deaf and Hard of Hearing to achieve their new strategic plan? We have 3 deaf associations, LAD, OAD, and EAD. and we can partner with the commission to share resources to make our deaf community stronger. We really need that here. I'm thankful that Kyle came to this position. Thank you.
Oh, wonderful. All right, thank you, OAD. Last but not least, we have Public Service Commission responsible for the N-STEP program. Brett, you want to come on up? Hold on just a second.
First off, thank you, Kyle Myers, for inviting me out to take part and speak to the community. I'm with the Public Service Commission. My name is Brett Bodie. I am the program administrator for the TRS and NSTEP programs that we operate for the state of Nebraska. Norm, you did a great job earlier in describing a lot about the TRS program and his role in the advisory board. Thank you. And so my primary role is just that I administer the TRS program throughout the year so that we have that support for the state of Nebraska. And then my primary role is functional administration of the equipment program, the NSTEP program, where we're offering telephone equipment for the deaf, hard of hearing, speech impaired, and vision impaired communities, trying to just help get them equipment that can help meet their needs for communication just in general. Anytime current things don't meet their standards, this helps to bridge the gap and hopefully improve their ability to just communicate generally with everybody that they need to communicate with. So I think, as Norm mentioned, one of the main things we do, or I help to do, is coordinate the meeting for the advisory board each year. Norm did talk that we bring various advocates in to try and help us decide what kind of legislative action we need to take from a public service commission standpoint, or how we can change our program to sort of better meet the needs of these communities. Another major action we do is that we set the surcharge that funds our programs. Each year we do a financial review and figure out what that rate needs to be. Basically, we rely upon all of the phone carriers in the state of Nebraska to pay a regulatory fee surcharge, and then that is what funds our program so that we can provide TRS services, but then also provide funding in our voucher program so that people can get equipment, meet their telecommunications. So most of my time is just administering those programs and trying to meet the needs of the community with questions and helping them get support with our vendors, or anything that we can do to make the program successful. So I think that's it. I was going to say I do have some brochures, just general brochures for the program, as well as in-step applications for anybody to the extent that anybody is looking or needs that. You're welcome to stop and ask me for any of those while we're here tonight, or I can leave them as a resource. Otherwise, you're welcome to reach out to me at any point in time for questions, and I'm always available and happy to try and address those for everybody. Is any question? Oh, the standing question, yes. I think in general, I try and partner with NCDHH on maybe not all sorts of different levels, but I feel like we are very complementary in the context of my whole program is there to try and facilitate making some changes from a legislative perspective and helping improve access to equipment and specifically, but also through our advisory board, we have a chance every year to kind of hear changing needs and take that into account for potential legislative corrections or changes and things that we can do. So, I mean, I know our overall Public Service Commission gets a chance to take feedback and try and act on that at least once a year. So look forward to continued partnership. Thanks.
So we're almost at the end. We're not quite finished. So these are all important stakeholders. Don't forget that we also work with DHHS, the judicial branch. We work with different government agencies, which aren't here tonight, but we do work closely with them to make sure of changing policy, improving access. And so there's a lot of work to do. We have our important stakeholders here tonight, but we also have important stakeholders who are not here tonight. So if you have questions for me, for NCDHH, the commission, if there's any questions, I'll open it up to that. Are there any questions?
Yes, we do have a question on Zoom. As part of the commission's strategic plan, how much outreach do you plan to do to let people know the requirements for assisted listening systems at your meetings, or at their meetings, and in public meetings in general, public events, performances, theaters, things like that?
This is Kyle. That's a great question. That is one of the top priorities in our goals, that we want the commission to focus on accessible communication. What that means and how it's delivered is something that we will be working on together. What is equity? How do we deliver that? Access to technology and equipment and services and resources, all of that. So that's one of the important parts. And at the end of the day, we want people who are deaf, hearing, hard of hearing, to have equitable access to service, whether that's equipment, devices, hearing aid, loop systems, all of that. Any other questions from the audience here? Any questions on Zoom?
You have a question. Sorry. We have a question for Brett.
We may have a question for Brett. What is the best way to start an application or start the process for people who want to apply for the NSTEP program? And do you have a contact person for assistance or questions?
If there's the easiest way to start from an application perspective to NSTEP is, I mean, the easiest way would probably be to just contact me and let me know. We either can, I can either point you to our Public Service Commission website, where we have electronic copies of our application, lots of information about the NSTEP program. That's obviously available all the time. You can also contact me directly, and I can put together a packet and send that in the mail that would include the application, as well as instructions and clarifications about the program and just all sorts of information just in general about the program. So, I mean, you can either contact me directly or you can take a look at the Public Service Commission website as a starting point. And that has a link for a for consumer page off of the main Public Service Commission website. And in the for consumer page, there's a section for NSTEP that you can go to that then has our application and all the information there for the NSTEP program. The commission obviously has lots of other programs. So, I mean, the for consumer page addresses all of the different consumer access programs that they support, but the NSTEP page is one of those on that for consumer page. I hope that addresses that. Is there any follow-up question? Yeah, thanks.
So this isn't really a question, but for Kyle to reply to. That's great. I'm happy to hear that. As you all know, ADA has rules and requirements, but still, there's too many places that should have assisted listening systems that don't, including government facilities. So thank you. I would welcome connecting with you to see how I might be able to become an advocate. Thank you so much. This is Kyle. Wonderful. Thank you for that. Great. So to wrap up, before you go, I'd like to thank all of our stakeholders and have them come up here for a quick photo op. Richard, do you want to make any last final comments before we close for the night? Look at here. Look at here. I'm wearing the ribbon. So for the past 2 hours, this has really inspired me. Nebraska Commission for the Deaf and Hard of Hearing members are now feeling inspired by their new director. And now we have stakeholders who have been involved in this process. And we need to keep on creating this impact. Lincoln, Omaha, all over the state of Nebraska about the commission and their resources to improve services, promote leadership, be welcoming people who are interested in working with people who are deaf and hard of hearing. Let's keep this going. This has been beautiful. Board members, we have the right chemistry to work together. Thank you, Kyle. Good job. And thank you to everyone here, all of the staff. Thank you for coming tonight. It means a lot to us. Thank you.